Hello everybody, welcome back to UWorld's NCLEX Question of the Day. I am Nurse Jazmine, and this week we are going to be doing emergency and disaster nursing. So let's get started with today's question. It says, the nurse is triaging clients at the site of a mass casualty event. The nurse should ensure that the first client transported to the hospital is the client who has... So what are we looking for? We're looking for the most critical client that can still be helped because it's an emergency and disaster event. All right, so you can pause the video and take a look at the options, drop your answer in the comments. Let's look at option 1. It says a cervical spine fracture and fixed pupils. So this is incorrect because this client has a cervical spine fracture and fixed pupils, likely indicating brainstem damage. So this is a critical client. However, in triage, this client would be considered a black tag, so survival is unlikely. Option 2, an abrasion to the left leg and warm left foot. This is incorrect. The client would not need immediate transportation to the hospital. They would be considered a minimal level of priority or a green tag. Option 3, a closed fracture on the right arm and bruising on the right hand. This is incorrect. This client would be considered a green tag, again, minimal level of priority, since they have an upper extremity fracture. And option 4 is going to be our correct answer, an incomplete amputation of the left forearm and a palpable radial pulse. So this client needs immediate attention. They would be considered a red tag. They have an incomplete amputation and they have a palpable radial pulse. So this means that there's a chance of saving the limb. So again, the correct answer is option 4. Click the link in our bio to find out more information on UWorld Nursing.